agenda from Katie, but we're going to start sending that out a couple days beforehand, before the meetings. Hopefully that'll maybe get a little more engagement from folks, or at least that's our thought. But I don't know if everyone in here has been on here at the same time, and if everybody kind of knows everybody and what their roles are at their institutions, because because it changes around a lot. So if everybody wants to do introductions, we absolutely can, or we can skip that part if you guys want to. I don't know, show of hands maybe. If anybody wants to do it. All right, we'll just get going then. So our last meeting, we had about 8 or 9 folks on that one, and what we were talking about was just at any point if we wanted to kind of update some of our sector strategies, the healthcare sector, and you can always get on the website and kind of recheck those. But we have 4 healthcare, 5 healthcare, I can't remember now, strategies, and they overlap a little bit. But we were thinking about maybe going over those again at some point, having like another little summit of some sort, or maybe just doing it within this group. So that's definitely an option, and I think something that we can look into. And then we kind of just talked about the 3 different sectors that we have: the Just Walk, the curriculum group, and the billing and reimbursement. And we kind of got the billing and reimbursement restarted, which is nice. And then we'll let everybody know that we're kind of going every other month now with the healthcare sector meetings, with the broader healthcare sector meeting, and then with the subgroups kind of in those months in between. It's kind of the plan going forward. So one of the big things that we also talked about, Katie and I chatted last week, and we think getting because at one point I think we had a lot of folks on this meeting, and it's kind of dwindled a little bit over time, and there's various reasons for that. But we're wondering if we could get some other programs to engage just around the city and contacts people might have. And when we talk kind of healthcare and education, it doesn't have to be med school, pharmacy school, nursing school. It can be residency programs. It can be just even like professional development within a hospital system, something like that. So it doesn't have to be the big, huge, 200 student kind of classes. So we'd like, any level of education engagement within the curriculum group. That's kind of one of the things we wanted to get the group opinion on. If there's any groups, like, just talking have a resident with us today, or not today, but this week in clinic, and he's from like the Lee Summit Medical Center family practice residency. So it's smaller. It's not really associated with UMKC or KU or any of the big schools. So it's harder to get those engaged unless we reach out directly to them. And I just didn't know if people had, certain contacts, things like that around the city that we could get, some better engagement from. So that's like go ahead and fire away if you got any thoughts.
Hey, this is Dan. Good morning, everybody.
Good morning, Dan.
Good to see everybody. I think the more we engage in, kind of focus areas that are ours, the more perspectives we get and ideas we get, and solutions to make things better. There's resources. You mentioned city and county, and, we could involve some at the state level in the policy halls of policies. There's the and I'm thinking more educational right now, but there's lots of areas we could focus on within the healthcare. But the Kansas Health Institute, they're based in Topeka, and they do a lot of different things. about with rural health and with community health coverage and policies on all things, a lot of things for Medicaid and Medicare. So I have some contacts down there. I could reach out if that would be something down the road once we kind of find our direction. Um, there's a lot of program managers too that are kind of expert in different areas and I'm thinking more on the um, reimbursement, billing, and coverage. If there's something that's not going through, we're not getting reimbursed, or some of these things might require a prior auth, but they are covered. And I'm looking forward to, let's see, I think our reimbursement meeting I think it's next week, a week from today, maybe, I think is what we have. Is that right, Katie? Yeah.
Yeah, it's
Yeah.
next Tuesday. I believe it's the 21st.
Yeah. But, that's one thing, I mean, there's people in the legislature that could always provide, we could share things with once we have some ideas. Community,
Yeah.
community providers and specialty services that are in the community that maybe your team refers for um, better health, and making sure they're getting their assessments, their health assessments and things like that.
Yeah,
So I have
definitely.
lots of
Yeah,
contacts in those areas if there's
yeah,
any
those.
interest in that.
Yeah, I'd say, invite them to those billing and reimbursement meetings if they've got anything they can contribute, or um, if they have things that they need help with. Either way, I
Mhm.
think that would be a great group of folks to add in.
Kind of collaborate. Great.
Yeah, for sure. I mean,
I'll
that's
put together a list and kind of some ideas and shoot it over. I guess we could send it out to all and maybe start a list of contacts and maybe folks that we might want to include in the, like say, county, the city. There's lots of um, nonprofit folks that are in the trenches that might be helpful.
yeah, yeah. We've got a kind of a standard letter to invite anybody that you want. Katie and Robin have all that kind of set up. So if you get names and emails, or I don't know, Katie, we were talking a little bit about how email sometimes doesn't get the engagement we want. So even cell phone numbers and things like that might be helpful.
Yeah.
Text messages. So and I think some organizations, I think some emails get blocked too. I mean, I don't know if that's anybody's fault or anything for not engaging it. Sometimes I just don't think it gets to them. So
Yeah,
Yeah.
that's actually something we're dealing with over at KU right now, is not all of our emails are going to some of our contacts. I'm working with their IT department right now. But Dan, I can send you that template that Jay was talking about. And in the meantime, though, there is a link to the billing and reimbursement group through Outlook, if that would be helpful. And if you generally know the person very well, you can send them that link and it'll send a request to me to approve them to join the group. So that's an alternative option.
Great.
Jay, did you say with the Lee Summit Family Medicine residency, you already have somebody?
No, it was just a thing because I had a resident come through, and that was the first time I ever had a resident from that group. He came in with us last week, and I was like, "Oh, so you're at UMKC?" And he goes, "No." I was like, "Oh, research maybe?" No. I was like,
No.
"Oh, how many residency programs are there?" I'm just ignorant about it. And I guess there's several around the city, or in the outskirts, or rural Missouri, rural Kansas, that might have some engagement in Kansas City. So it was kind of a little eye opening for me because like I said, I was ignorant about that. So
Sure. Well, the Lee Summit one's fairly new. I know Karen Foote is the program director there. I can uh, get that address and put it in chat here in a minute, if
Yeah.
that would be helpful. Um, Another name I want to ask about, and she may already be on your mailing list, you guys, is Amanda Grimes. I think you know Amanda. She's already on your list, right?
Yeah.
Okay. Well, let me get Karen Foote's email address and I'll put it in chat.
That'd be awesome. Thank you so much.
You bet.
Yeah,
Um,
Amanda's a great resource. She does a lot of grant writing, I think, and she's very active. She's an active person. I think she might even ride to work. So she lives the dream.
Yeah.
um, yeah, and anybody else, if you got any thoughts, you don't have to speak them. You can just throw them in the chat. If you got any folks we should um, add to the list, see if they can join in. We'll reach out to them, or you can reach out to them and invite them. And again, Katie can help you get that kind of template if you need it. So yeah, and I think and again, collaboration. Somebody said it, or a couple of people said it. I mean, I think that again, that was like the number one goal of this whole KCPA plan was to get many different groups together around Kansas City who don't normally work directly with each other and try to get some brainstorming, some cross collaboration, some the ability of people to not have to reinvent the wheel in their program. They can get some folks around here who've done something before, tried a program before. So yeah, any thoughts? There are no bad thoughts on it. So and then yeah, I don't, if anybody's got anything else on that they want to bring up, feel free. If not, we can kind of go to the subgroups and kind of give little updates on those right now. All right. Well, the first one we got on the list was the billing and reimbursement subgroup, which again, just kind of talked about that a little bit there. First meeting in a while is going to be next week. And I think these are some of the thoughts for that meeting. It's going to kind of identify members and again, try to add some more members who can help with payers, clinical coding, policy expertise, any of that kind of stuff. And then figure out what the best physical activity counseling codes, see if there's any major changes in that over the last year. Talking about wearables and remote monitoring and any preventative technologies and documentation and denial trends, because that's always a big deal. I mean, if you can't get paid for something and you're going to spend a lot of time doing it, you probably won't do it as much. So yeah, those are kind of the focuses of that group. And Dan, I don't know if you got anything more you want to add to that.
Yeah, let's see where are you looking? Are you out on the webs on the? I saw this different strategies. You said there's 3 or 4. Is that what you were looking at just now?
No, the thing I'm just going over the agenda that Katie sent out.
Okay.
I don't know. I think everybody got that on their email. But yeah, it's just the things I was going down. But if you have something else you want to add to that, we can always bump up the agenda next week.
I think I'm always interested in outcomes and the tracking, the clinical data, is where kind of the rubber hits the road. That's all this, all our efforts, are going into improving the outcomes in the most efficient way, and easiest way for the patient to engage them and make sure make sure, our providers are getting good, star and HEDIS ratings, and we and that kind of leads into the policy stuff with the state. We can maybe get data and see what kind of improvements are maybe happening year over year. A lot of that stuff, and I can dig around. I'm pretty good at that. I just from my Medicare and Medicaid days of pulling reports off the MedicareData.gov sites. I don't know if anyone's familiar with that. There's a ton of information out there on different reports in different states, and a lot of times it even breaks it down by county. So that could be helpful as well.
Well, that is stuff to look forward to for next Tuesday, sounds like. Anything else on that, Katie? On that meeting or anything? Nothing else to add? Okay. Then the other subgroup we have is the curriculum group, and that's the one I've kind of been the most involved with. So again, we a few years ago had some great guest speakers coming in and kind of explaining how to add physical activity and really lifestyle medicine. I mean, honestly, it was lifestyle medicine, physical activity, just one of the pillars, 6 pillars of that. And I think that went really well, and people got pretty excited for those speakers, and some changes were kind of started at the med school level. And kind of what's interesting with that is, again, in the last year, there's kind of been a mandate that nutrition is going to have to be a huge piece of medical school, and I assume eventually nursing school, PA school, that kind of stuff, curriculum. So again, nutrition is part of that lifestyle medicine pillars, but kind of worry a little bit that maybe physical activity will get pushed aside if the mandate and the focus is just on nutrition. So hopefully it'll all kind of stay integrated in that lifestyle medicine idea. But what we're kind of curious is how much it's really changed at the med school level. I know we made, at least at UMKC, at the clerkship level, with the peds and the family practice, and then in the residencies, we still got some stuff going, and some ideas that are moving forward on increasing that physical activity education, and learning how to do like a physical activity prescription and things like that. And I'm talking about some wearable things, but kind of what we were curious about, again, this was Katie and I kind of brainstorming last week, was what kind of things people actually want for their various curriculum, whether it's school, whether it's residency, whether it's nursing programs, whatever. The people want more modules that they can tell their students, hey, go do these. You got the afternoon, you can do 5 modules or whatever. They want more like slides and a formal lecture kind of thing. Do they want some sort of assessment? Do they want stuff more for faculty rather than just for the students and the residents and stuff like that? So kind of curious about that and people's thoughts on that. And then when people are able to get these, some programs implemented for education, are there gaps? Are they finding, hey, this was working well, but we really need this, and this? So just as people are going along, are they running into barriers and places they can would need help, would want help from the group? And then again, how to get those other programs more involved. We kind of talked about that earlier. I think we just need more folks from those programs to be here and give their input. So, and then again, the collaboration part, just trying to get, KU, UMKC, KCU, those kind of things working together. And then again, the nursing schools working with the med schools and things like that, have more of those integrated, I forget what it's called at UMKC when everybody gets together in the small groups.
Oh, the interprofessional education,
Interprofessional
IPE.
education.
Yeah.
And those are just wonderful. It sounds like and an awesome way to get people kind of working together even before they finish the education part, before they get into actual clinical work. So if anybody's got any thoughts or ideas on those, feel free to fire away.
This is David Varan. You
Yeah.
might be interested that the dean and Mike Wacker and I and Jeanette Berkeley Patton and others are working on a curriculum up at the St. Joe campus to send our students out into rural areas up there to not only incorporate Help Mosaic Life Care, incorporate data into their electronic record, but to follow Jeanette Berkeley Patton's Fit for Life weight management exercise and program that she's been doing for about a decade down here, and trying to weave that into our curriculum up there.
That's awesome. Is it been pretty successful, or is it still kind of in the infancy there?
Oh, just in the starting and funding phase. But Jeanette's program has been extremely successful with churches and community involvement.
That's awesome. So she goes out into the community, or does she get them to come to her? How does that work for that education piece?
Actually, she goes into the churches and has taken medical students in the past, mainly with the PA program, to actually go do teaching sessions. So they're not certified, but they learn how to do community health workers and things like that. Hey, I've got to tee off right now. I'll be right back with you.
No worries.
Hey, David. Hey, David.
like
Ed
that.
Kramer here.
Hey.
Good to hear your voice.
And you're being active. It's great. So yeah, I mean that sounds like a wonderful program, and something that if we can, Katie and I were talking about this, is maybe at some of these meetings having like a little presentation from someone like that to all of our members, so that people can get a better idea how it got started, how it's going, ways they can kind of do something similar, or heck, the exact same thing if they need to get some of those programs working. Because again, don't have to reinvent the wheel if somebody's doing it well. You kind of do it similar or exactly the same.
Yeah, well, we're working with a little bit with Heidi Miller from she is the state or Missouri Department of Health and Senior Services medical director, who is trying to spur us to use technology in the fields a little bit better throughout the state of Missouri, particularly focused on the rural areas. And so that's where we're headed.
Deal. Yeah, I think it might be interesting if we can get her to come give us a little talk on how she does it. That'd be fun. Okay. So then, Katie, I know we didn't put it on the list, but I didn't know if you had any updates on the Just Walk stuff, since we got some new folks here, different from last time.
Are you asking me if I have any updates on Just Walk?
Yeah.
Oh, I don't.
Okay.
I'm
We
sorry.
got a few programs around the city. There's so it's Walk with the Doc, Just Walks, similar, basically the same program. And UMKC has a couple successful ones. I think KU is working on one, and it's been implemented, and I don't know the 100% of the specifics of that. And then Children's Mercy and the KCPA plan has one downtown. It's currently more in the employee wellness part at Children's Mercy, but patients and families can always join, and other folks in the Hospital Hill area can join if they want to. Is it Wednesdays, Thursdays? The one at Hospital?
So, the one at hospital, because they switched with Crown Center. So I do believe Adele Hall is Wednesdays and Crown Center's Thursdays, and I can't remember when the Broadway location is because that one is newer. But I know that UMKC, they're the third Saturday of every month at Southeast Community Center. So there's a link in the chat if you're interested in learning more. Stephanie Ellison leads that. And then I will try and find more information with our Children's Mercy Walks.
And yeah, Stephanie's has been awesome and very successful over the years. They got folks who even go out on that non-Saturday, and the other Saturdays they've made their own little walking group. So that's exactly what the goal is. Okay, and then kind of what we talked about earlier on. So kind of redoing some of the sector strategies. We were thinking of making another small group to go over that. And I mean, we could make it a small group. We could just do it honestly at the healthcare full sector meeting if we really want to. It doesn't have to be a small group, but if anybody's interested in helping to update some of those sector strategies that Katie put in the chat, we'd love anybody's input because just want to. It's they're 5 years old now, 4 years or 5 years old, so probably couldn't hurt a little refresh. So yeah.
Hey Jay, back to the curriculum just for a second. One thing I can speak to, and she could do it much better if she were here, and by she I mean Sarah Cox, certified PA and also one of our UMKC PA faculty members. And for those of you who don't know, I'm the medical director of the UMKC PA program until June 30th, when I officially retire from that. So anyway, Sarah has very successfully and intentionally introduced lifestyle medicine into the curriculum of the PA program. And it's not easy to start something like that, but it may be a little easier in a PA program rather than a big medical school. We're part of the medical school, but we have our own curriculum committee and things like that. So probably a little bit less difficult to kind of introduce something like that. And she's doing a really great job of it. It's actually a significant part of a course called Professions 4. And I was able to attend the other day. She just tried a brand new session where she had each of the groups, small groups of students, kind of come up with their own session to lead for about 10 or 15 minutes on either some activity to get the group going or something about nutrition and that sort of thing. But it was, and she started it off by leading us all in a Zumba class, which really got my heart rate going. So anyway, lots happening at the PA program, and Sarah Cox is the one who's making that happen.
So when she's doing that, is she the main lecturer on that, or does she do other folks sprinkle in and do some stuff? How does that work mostly for her?
I know she is the main presenter on those things. I don't know. I wouldn't be surprised if she had some guests coming occasionally, but I think she's primarily doing it. And I'm guessing it's primarily off the national lifestyle medicine curriculum.
Yeah. That's great. Well, again, she's been doing it, what, 1 year now, 2 years with that?
Well, I would say probably a year, and then our year, this is with the year 2 group. I'd say she's probably been doing it for a year and maybe increasing it a little bit each semester would be my guess.
Yeah. So yeah, if she wants to, kind of give a breakdown of how she's made it happen during one of these, that'd be awesome. I know she's been to a couple of these meetings before.
Yeah. She attends when she can. So whenever that fits for you guys, you can reach out to her directly and I will totally support that and help her out if I can. But she's super busy like everybody, but she loves this kind of thing. So my guess is she'll be happy to talk about it.
Cool. Very cool. That'd be great. Yeah. So if again, if anybody's been doing anything themselves, anything that's working for them, and you want to kind of just give a little breakdown for the group, at any point, we'll be happy to give you the floor for 10, 15, 20, 30 minutes, whatever, however much, information you got to give the group. We're happy to bring it along. And if we can set stuff up, even beyond this group, if we can do grand rounds or, smaller things at any of the schools or any of the residency programs, or just at a hospital, just an education thing at your various hospitals that you all are at. If you want something like that, we can try to help facilitate and make something like that happen. So that's really, again, the goal is to spread the knowledge, spread the wealth if you're doing something that's working. All right. And then the last thing on the agenda, if anybody's got any updates, anything they want to just chat about, talk about, the floor is yours. Or any questions?
Hey, I have one thing, just to update for everybody. I went to the, let's see, it's, I can always call it Walk Bike KC or Bike Walk KC round table, meeting the other day, and they really had a cool outline about Mark, guides this. And I know Mark is kind of involved. Is Mark affiliated with our, physical activity group? Are they kind of supported? I know the science and a lot of those things are driven by their policy and direction of funding, and they're one of the ones that really kind of bring everybody together from the different governments, fed, state, local, city, and then they kind of bring that together with the business and industries in their, what is it, 4 or 5 state area. But they gave it was about an hour and a half, a presentation on the transportation program and all the assets for trails and walking. And, we need better access to in certain parts of our community that don't have safe places to get outside and get off the damn phones and be live a good life away from the screens. And it was just a really good presentation. They talked about the last time, I think the transportation rollout was like in 2015 or 17, and they're getting ready to do another one to kind of update new goals, new fundings. It was very interesting. I don't have any documentation from it, but I think I'll get some slides from it, because it was really good information that and it was representative. I'm talking about, like, mainly it was talking about greater Kansas City, Johnson, Wyandotte, our metro area, about what they're doing and with trails and bike routes, and trying to get people to be able to access work other than jumping in their car and going there. There's different and other modalities, but really just access to parks. And one of the things you mentioned, I think, James, was that you mentioned something about schools. They have a number of programs in place for education and activity in the schools. They mentioned that. I don't know what those programs are. I'll try to find out from contacts over there at Mark to share with y'all.
Yeah. And I think, we got the school sector, we got the park sector, maybe the built environment, all those things would also be a good place for those, for the Mark folks to be involved. But Katie, I don't know, you said they are part of the group a little bit?
Yeah, Mid-America Regional Council is part of the infrastructure sector, and they've participated with our school sector during Bike Month. So yeah, and we're also working on another project with them to do to map all of the youth sport programs within the metro. It's like over 4,000 programs. So yeah, they're definitely actively involved with us. They're great.
Yeah.
Okay. Well, if nobody's got any other updates, then we can give everybody a few minutes back.
Oh, Jay, I
Oh
do
yeah,
have
you
one.
got Katie's got it.
Um,
There we go.
So I just had a quick follow-up question. Oh, darn, he's off. I had one for David about the Fit for Life program, but that's okay. I've worked with Jeanette, so I can go ahead and reach out to her. Jay, I actually worked on the Fit project, and I was just wondering if
Oh,
it was a
awesome.
continuation of her, yeah, initial one. So, um, the other thing I have is an update. We have a KCHLC quarterly meeting coming up in June with Dr. Ao Olagoki. I apologize. I'm pretty sure I said her last name right. But she will be speaking about the use of AI and how it can better support health communication for healthy lifestyles. If you know of anybody who would be interested in this topic, I'm going to go ahead and post the invite in the chat. This is a hybrid event, so it will be in person. We'll have an in-person option as well as virtual. However, Dr. Ao will be presenting virtually, just a heads up. But we're still going to have it in person at the Kaufman. And we'll provide breakfast. It's free. It's open to anybody who's interested. So just throwing that out there.
Awesome. Yeah, it's always a good meeting. It's maybe you can get to it. Just wrong time of day for me sometimes.
Yeah, it's early in the morning, and this one's on a Tuesday. Actually, Jay, it's on a Tuesday.
Oh, well then I
Yeah,
could make that one. Yeah. Yeah, it's usually on like a Thursday or Wednesday. So
yeah.
cool. All right. Any other stuff, Katie? Don't want to cut you off.
No, not for the group. I've got one thing I wanted to share with you after this
Okay.
meeting. If you have like